Hi, this is Tom Edmondson for meaningandministry.com, also now known as pastorallogotherapy.com. And I have a treat for you today. I'm sitting down and talking across space and time with Dr. Christopher Wurm, who is in Australia. And what's really cool about this conversation is that it is Friday afternoon in San Antonio, Texas, where I am at the moment, and the sun is still shining. And it is Saturday. Did I say Saturday? It's Friday afternoon in San Antonio, Texas, and it is Saturday morning in Australia. And I assume the sun is shining where you are.
The sun is shining, but it's actually going to be a very rainy day,
Oh, yeah.
which is particularly ironic because South Australia is what they call the driest state in the driest continent.
Wow.
So when we're going to get some heavy rain, people really sit up and take notice.
Okay.
So
Well, I hope that you will get the much needed rain, which I assume that you need to have.
thank
But
you.
anyway, here we
Yeah.
are speaking across time and Friday and Saturday simultaneously. That's pretty cool.
And I think not to mention the physical distance.
Right. Yeah.
Yeah. Yes.
What a
So.
what a miracle technology is. And what I really appreciate about this technology is it allows me to connect with people like yourself and colleagues around the world who are logotherapists in one shape, form, or another. And I just think that we have the best community of people. So tell us a little bit about yourself. I know you are a specialist in addiction. Uh, Medicine, I guess, is the right term. But tell us about yourself and how you came to logotherapy.
Sure. I was born in South Australia, a city called Adelaide, which is a population of about 1 million. I come from a family who my ancestors arrived in South Australia in anywhere between 1848 and maybe, I'm trying to think, one of my grandmothers was born in England. But yeah, we live in a state that, of course, before Europeans got here, there were already First Nations people, so Aboriginal people who perhaps were somewhat disadvantaged when some of the European settlers came. So I'm always very conscious that I've got a lot of good fortune, a lot of privilege, and it's actually quite useful to stop and think what are the things I'm grateful for, what are the advantages I've had, and so I think I was. The third generation of physicians in my family. So my father and my grandfather were also in the medical field.
Oh,
I was especially fortunate that when I left high school and went to university, we had a government who just brought in that tertiary education would not cost the students anything.
wow.
So so yeah, I didn't have to get loans. I didn't have to borrow money or pay fees. I think we paid union fees for the benefits of some of the sporting clubs
Mm.
and things that were provided by other students and student organisations. But yeah, so that was one type of good fortune, one type of privilege. Um, Turns out I was also quite fortunate to have a bit of a gift for languages. So when I was at school, I did reasonably well academically, but my best subject was German. And that probably brings us to how I first was exposed to the work of Viktor Frankl. I was probably in about fourth year at university. I should have been doing some pathology homework. My parents, I lived at home still. My parents were watching television, and the Australian Broadcasting Commission had somebody being interviewed who had an interesting accent. And so as I walked past the room where they watched TV, I sort of came in and sat down, and I heard this Austrian psychiatrist And he said, some people are unhappy not because of their past, but because of the way they deal with the present. And that was Viktor Frankl. So that was about 1977.
Okay.
And I had a little bit of what we call behavioral science as a subject in medical school,
Mhm.
but nearly everything else I thought I knew about psychiatry, I probably knew from television, from movies. So probably not terribly well informed. I had all these assumptions, and my understanding was that psychiatry was all about digging into the past and wanting to talk about people's early childhood and to hear Frankl say, look, um, the things that happen in the past are still relevant, but it might not be the most useful thing to focus on. But for some people, talking about how they handle the present is potentially more useful than to be talking about the past. And that was revolutionary for me. And I think I then decided I'd better read up on this man. There were one or two books available in the university library, and I actually continued to learn German for 1 year at university after I left school. But eventually, I wound up graduating, and I listened very, very carefully to everything in the psychiatry training as a student, but not once was his name mentioned. Not once
Mhm.
was, as far as I can remember, the word philosophy, existential, uh,
Right.
concepts of meaning and purpose. So there were certainly concepts of id, ego, superego. There were concepts of learned behavior. There were concepts of psychopathology and mental illness. But yeah, the things Frankl talked about, I learned about outside of the university. Um, and ironically, now I do have a position with Adelaide University, although we have an understanding that they don't pay me and I don't do very much. But I'm sort of, I'm on the staff, but I'm not on the payroll. So
Oh,
I
wow.
have a title as visiting fellow.
Okay.
But certainly, because I was particularly interested and particularly impressed with Frankl's approach, it seemed to me that if I actually chose to do psychiatry training, I would probably be taught a lot more about psychoanalytic psychotherapy, psychodynamic psychotherapy, cognitive behavior therapy, and also medication. And I just had a feeling that if I was really interested in Viktor Frankl's ideas and his work, um, it might be actually uncomfortable to do psychiatry training. That may have been a misunderstanding. It may have been that perhaps there would have been more people who were open to his approach. Certainly now, I find that quite a lot of people are familiar with his work, although there'll always be misconceptions.
Hmm.
But uh, then the question was, if I'm not a psychiatrist, how can I make his work part of my career? And certainly, I decided to train as a family physician, so as a general practitioner. And there are lots of people that come to their family physician with dilemmas and worries and sadness, and maybe not necessarily all with a psychiatric diagnosis. But so that was certainly a field where I think there was a lot of relevance. But I also ended up getting two different jobs that seemed to give me a lot of chance to apply the existential concepts, and one of them was in a hospital-based counselling clinic, and another one was a hospital-based drug and alcohol unit. So people would be admitted to hospital because they had a broken leg, or liver disease, or heart trouble, or an infected disc in their spine, but if there was an issue to do with their alcohol use or their use of amphetamines or heroin, our team would be asked to lend a hand. So we weren't the admitting treating team, but we were asked for our opinion, and over time I found that there was a view that one of the most effective ways to get understanding and rapport with people with a substance problem was a technique called motivational interviewing.
Mhm. Right.
That was actually developed by a professor from New Mexico, William R. Miller, and so in his very first article, he talked about the way you ask questions, and you ask about what is it that appeals to you, what are the good things about the role of alcohol or cannabis or amphetamines in your life, and then he would also say what are the not so good things.
Mhm.
But in his very first article, he said this type of questioning, this leads to a more existential type of counselling. Um, so I haven't really talked about when I actually managed to um, take part in logotherapy training. So I left medical school. I graduated and became an intern in 1980. And I was working in various jobs as part of becoming a family physician. And in one of my jobs, I moved interstate. I moved to Newcastle in New South Wales, and thought, look, I might still try to brush up on my German. I enrolled at the university there, and there was an Austrian lecturer. And I told him, I really, really would like to get in touch with this Professor Frankl in Vienna. Um, would you mind checking my grammar, checking my spelling? And he
Mm.
said, really, I think somebody as important as Frankl is unlikely to respond to a letter from somebody like you. But let, let me write to him with my title as he had a particular title within the Austrian Australian, I forget whether it was the Chamber of Commerce or uh, organization, but ultimately, Frankel did write back and he said, please do tell your young colleague that there is no training at the moment in Vienna, but there is something happening in Chicago. And then later on, I wrote to the people in Chicago, and I also approached other people. And a few years later, eventually it turned out that there was some training that was begun in Vienna. So after I'd been working as a doctor for 4 years, I then had a year of travel.
Mhm.
And some of that time I would go back to Vienna for 2 weeks at a time. And there were three fortnight-long block seminars. But during one of the fortnight courses at the Institute for Logotherapy and Other Methods of Psychotherapy, Frankl himself was giving a series of lectures at the University of Vienna, and I was I think there were maybe two other students for whom German was not their first language. There was a person from Korea,
Mhm.
there was somebody else from Romania. So, but yeah, I wasn't completely sure whether I understood everything well enough. But if I went to the university lectures, then if I wasn't enrolled at the University of Vienna, but students from that university, if they wanted their attendance at those lectures to count, they had to sit a test. They had
Mhm.
to sit a written exam.
I see.
And so the other people doing the block seminars didn't necessarily sit that exam. So I was sort of competing with people who just
Mhm.
went to his lectures.
Oh,
Um,
wow. Yeah.
but and in between these fortnight visits to Vienna, I would go back and spend time in England where my brother was living, or I would just travel and sightsee. But I went back to my brother's home in England, and a letter arrived from Vienna, and it was on some pre-printed paper, and then there was handwriting And the pre-printed paper was all in German. It was from the University of Vienna. But it took a little while till I realized that Viktor Frankl was handwriting in English. And what he was saying in English on this German document is, out of 20 students, yours was the best result.
Oh, how
And
nice.
so I felt very very reassured and yeah, that was pretty exciting. So it took me quite a
Congratulations.
while to actually understand the
Yeah.
handwriting. In fact, later on, he was still writing books at that time, and I've got one here that this probably doesn't show up terribly well at all,
Oh, yeah,
but
I can sort of see it, but yeah,
yeah.
you must allow
It-
for blah blah blah. I can't read it. How about
So
that?
once again, it's in German uh,
Yeah.
for Chris Worm with all good wishes.
Oh, see,
Um,
I was reading English. That was working for me.
okay, well, look, yeah, uh, herzlich, Viktor Frankl,
Mhm.
Vienna, and I must admit, I really can't quite work out what year it was, but the book was released in 1986, and I think he probably sent it to me as soon as it had been published. So.
Wow, that's awesome.
So yeah, yeah. So he was actually really, I think, struck by the fact that somebody would come from Australia to Vienna to train and study. And I think he had a soft spot for Australia. I think people generally hear about his experience of being gradually having his freedom restricted during the time under the Nazi government, and people are aware that his uh, brother and his wife and his parents died in concentration camps. But there was one sister who actually left Austria
Mhm.
and settled in Australia. And he thought it might be nice for me to meet her.
Oh,
So,
right. Yeah.
it turns out she had lived in Australia for a very long time. She was married. I think she had one daughter who I also got to meet. And but when I met his sister, she had exactly the same accent, but also the same sense of humor. Um, so
Imagine
um,
that.
yeah, but I think we should change the subject because
That's okay. Yeah.
I, I enjoy talking about him personally and his family, but I don't think I need to be here to name drop.
That's quite all right. I mean, certainly, uh, I didn't detect any uh, uh, excessive pride in that, but I think that's a story worth telling, and I really appreciate it. I also, your beginning, I noticed that many times when I listen to Australians who are maybe of European descent, always very careful um to state, you know, the fact that you're living on land that was probably taken from First Nation people, Aboriginal people, which is something that we in the United States don't do a very good job of. We tend to kind of overlook that, or there are a lot of people who still fight against that. But I appreciate that just very straightforward way. I don't know if I'm making sense to you or not, but I do.
Yeah, yep.
Yeah,
And certainly there's even a tendency now for people to say I'm um, speaking from the unceded lands of the Ghana people, or to
right.
actually acknowledge Aboriginal people, past, present, and
Yeah,
emerging. To and I think, in fact, the US perhaps has at least had some treaties with First Nations people, um, and maybe they didn't all go so well. But Australia, in fact, didn't even make treaties,
I
and
see.
there had been this historical view that a lot of things were done as if there were no people living in Australia. So people talk
Right.
about, Captain Cook discovering Australia. Well, other people had discovered Australia long before, but
Yeah.
they weren't they weren't writing books and getting newspaper headlines. So yeah, I
Yeah.
think
Nobody
the
else counts, right? I mean, from a Eurocentric point of view, nobody else counts.
well, and certainly, I think now it turns out that that there is evidence of Aboriginal culture and life in Australia for I think at least 60,000 years,
Mm.
and
Wow.
so yeah, there is actually this culture, and so yeah, so I think it's a, a a good thing to remind myself that yeah, my ancestors perhaps uh, arrived in a place at a time that I think the first of my ancestors arrived about 12 years after the first Europeans. So
Mhm.
I have no way of knowing whether they treated the local people with respect and kindness or
Right. Right.
not. But there's also a question about what was going on to make them willing to leave family, friends, comforts, language. So there must have been either some pretty desperate situations in Europe at the time,
Mhm.
or they were incredibly adventurous, or possibly an element of both.
Mhm.
And I think. Yeah, so ironically, my parents both grew up speaking pretty much nothing but English. I think they both had French lessons at school. So I had German-speaking ancestors, but yeah, around 1914, my understanding is they probably stopped speaking German in public, and uh, and I had to sort of go to school to learn German, but it came pretty naturally.
Mhm.
Having said that, yeah, the school I went to, they offered German, French, Latin, but
Mhm.
any notion of teaching uh, First Nations language, yeah, I can't even think how old I was before I found out the name of the local First Nations people and their language.
Wow.
So
Yeah.
I think there were some opportunities outside of school to learn some of the languages,
Hmm.
Pitjantjatjara rather than Ghana, but yeah.
I
But
see.
maybe now I might even talk about being an addiction specialist and thinking
Absolutely.
about
Yeah.
First
Yeah.
Nations people.
I was going
Um,
to bring that in, and if I may, okay, yes, please do. Um, in your previous statement that you mentioned sort of what I was going to label as metaclinical elements of counseling. But yes, please, if you will just if you can bring that in eventually, I'd like to hear a little bit more about that. But yes, so you
okay,
have
okay.
addiction counseling and First Nations people.
Yeah, and certainly in particularly in the north of Australia, the proportion of Aboriginal people who do not use alcohol is actually greater than for the general public. So, although people might have this image of problematic alcohol use, um, there are certainly Aboriginal people or First Nations people who do have problems with alcohol use. But there are actually quite a lot of people who've arranged to not have alcohol in their lives at all. So I think there's even something similar in the Republic of Ireland. There are all these stereotypes about a lot of Irish people drink, and alcohol is present in Irish culture, but there are also a lot of people who abstain. So
Hmm.
I
So
guess I
was
need to
alcohol?
somehow highlight that there are people in need, and there are people who
Yes.
have set themselves up to not use alcohol.
So here in the United States, when there was this westward expansion and the natives, uh, we say Indians, Native Americans, First Nations are probably a better term. There's this very well known fact that many people use alcohol as a way of dividing and conquering
Mhm,
the
mhm.
First Nations people. So that is or that isn't the case in Australia?
Oh, there are some quite shameful examples. There was a policy that Aboriginal people were not permitted to use alcohol, but if they could demonstrate to a government official, ironically called the Protectorate or the Protector of Aborigines,
Oh,
um,
wow.
that person could then say, "This person is so good at white culture." We could give them a document that says they don't have to be subjected to the restrictions of other First Nations people. Aboriginal people used to call that certificate a dog license. But then, if you were given that certificate, you were then allowed to buy alcohol and drink alcohol. But if you supplied alcohol to a different person, your brother, your sister, your father, your next door neighbor, then you were breaking the law because the other Aboriginal people weren't allowed to use alcohol. So there
Wow.
was a really famous artist called Albert Namatjira, and he was given this special recognition that he didn't have to be limited in his access to alcohol, except that it's fairly common that there is a lot of sharing that goes on in traditional and even less traditional Aboriginal communities. And he was then sharing his alcohol and was then, I think, punished.
Mm,
So
wow.
yeah,
Interesting.
yes. So but yeah, the job I have now, I work for the South Australian government in a community health setting where historically we've had a particular interest in anybody who is homeless, and that includes some Aboriginal people. We also try to actually prioritise people who are Indigenous, and there are some aspects of the health system that work quite well for Aboriginal people and other areas where they may feel less welcome. So yeah, it's good to work in a place where we try to have some representation on our staff. We try to have some openness, some understanding. And that's also yeah, given me a chance to read up on different examples of where people have looked at the role of alcohol and other drugs in Australian society. So you were hoping I would talk about metaclinical things, and I'm trying to think now. I'm not sure I used the word metaclinical, but yeah,
Well,
tell me
you did it.
what you were thinking.
So, I mean, this is the interesting thing about having a conversation with you because you're a doctor, a physician. You have clinical training, clinical experience, clinical credentials. I am a pastor. I have no clinical training, no clinical credentials. Therefore, when I practice logotherapy, it is a non-clinical or a meta-clinical approach. And in fact, in many ways, what logotherapy was founded as, in my understanding, is what does the surgeon do after he has amputated the leg? And he doesn't
Mhm,
say,
mhm.
"Well, my job is done. He must now speak to the human spirit, to the person. Here's how you live under these new circumstances, you know." Um, Metaclinical is also a term that he uses in Man's Search for Meaning in the Logotherapy in a Nutshell section. And in there's the German book, is a compilation. It's called Der Leidende Mensch,
Oh
the
yes, yes, yes.
suffering man. So my German is not great, but hopefully that was understandable to our German friends. Uh, but and there's a whole set there of meta clinical lectures that he gave.
Okay.
So I think what I'm asking you is, you're a doctor, and you can do pharmacology, I assume, and you can
Hmm,
handle all the mental and physical, psychological and somatological issues. but sometimes a lot of what you're dealing with, and you sort of hinted at this, is not not one of those two things. And so when I think about talking with you or another doctor who is also a logotherapist, it's interesting to have that conversation about what we have in common and how we have nothing in common in terms of practicing logotherapy. Is that I don't know if that makes a lot of sense or not, but there's a question in there.
Yeah, I think one of the things that really appealed to me right from that very first interview I saw of Viktor Frankl, the notion that he was interested in what people care about. He was interested in how people deal with situations. I think he would sometimes, rather than say, "Oh, you're very anxious, that must be an anxiety disorder," he would sometimes say, "You're very anxious. It seems like there are some things that it makes sense to be anxious about." So, and at the same time, he would say there are also psychiatric disorders.
Mhm.
And I think he would say if you are hallucinating, if you're hearing voices that other people don't hear, if you
Right.
have beliefs that you are being persecuted
Hmm.
and other people don't see any evidence that you're
Right.
being persecuted, those are significant um, abnormal psychological phenomena.
Hmm.
But you might also have something that it makes sense that you're anxious.
Hmm.
Your situation might also have maybe this. I have to go back and refresh my memory of metaclinical, but I think, yeah, he would sometimes say people have unpredictable circumstances, and if they're calm and relaxed, that's probably unwise. If you act as if everything is safe and secure
Hmm.
and predictable, that I sometimes say if people were capable of being totally free of anxiety, they wouldn't last very long. They would
Right.
cross
Right.
a busy road and not worry about whether there's a car or a truck, and
Right.
and they would be killed.
Yeah.
So, there's this protective element of appropriate levels of anxiety and fear. Uh, there is, and he talked about that tragic triad that in everybody's life, there is pain, suffering, or guilt, suffering, and death. And the idea that some suffering might be avoidable, but some suffering is unavoidable.
Right. Right.
That idea that you might be able to derive meaning from the way you respond to the unavoidable suffering.
Hmm.
But if you have avoidable suffering, then he would say you should go to the dentist for your
Right.
toothache.
Exactly right. Yes.
If you have a painful arthritic joint, perhaps there's some medication or some physical treatment that would help.
Yeah.
So he wasn't saying everybody who's anxious has an anxiety disorder.
Right.
But he
Right.
was also saying some people who are diagnosed as mentally ill, some of what they say might still be accurate.
Yeah.
And I vividly remember when I worked in a community mental health team, we had a patient who had a well-established diagnosis of schizophrenia, and it was acknowledged that she would sometimes hallucinate and that
Mhm.
she would sometimes have unfounded delusional fears. But a social worker who knew which street she lived in, when the patient said, "People are knocking on my door in the middle of the night looking for drug deals and sex workers,"
Mm.
the social worker said, "I know that street. They're looking for the house next door." And so the amazingly powerful therapeutic thing was to help move this person to a new address.
I see.
And that symptom went away.
That's
Now,
amazing. Wow.
perhaps she still had other symptoms.
Yeah.
Perhaps there
Yeah.
were still some hallucinations and some unfounded beliefs.
That
But
sounds a lot like neuro-linguistic programming.
um, look, I think of it as being amazingly skilled social work.
Yeah.
Uh, but certainly some other literature I've read. It, sometimes during my career, I've worried that people often talk about things being evidence-based treatments,
Right.
but
Yes.
some people have also talked about what are the easiest things to measure and count. And
Right.
of course, they're the things that are not part of that noetic dimension.
Mm,
They're things that aren't
right.
part of the spiritual dimension.
Yeah.
I think since I started training, since that first interview I saw on TV, I think people are getting better at researching some of these
Good.
questions. So I
Good.
think,
Because it sounds like when you say best practices, it's kind of like you're saying lowest common denominator in some way,
ah,
you
okay,
know?
yes. Um, and so I also sometimes think there is a lot of emphasis now on cognitive behavior therapy.
Right.
And at one stage, I needed some psychological treatment. I
Mm,
really did have a
sure.
problem with heights,
Hmm.
and I really didn't have the luxury of saying, who's my favorite local logotherapist?
Right. Right.
Um, but I found a clinical psychologist whose main therapeutic approach was cognitive behavior
Mm,
therapy, but he also had warmth and trust
right.
and
Right.
was prepared to say, yeah, I'm interested in what Frankl says, but what I've found is most effective in this scenario
Mm,
is progressive
yeah.
desensitization and exposure. And so
Right.
he got me to do some things that were quite uncomfortable, and bit by bit,
Yeah.
I was able to function much better. So
I don't doubt that
certainly,
Frankel engaged in some CBT, like when he had the lady get down on the floor with a rag and wipe it, and then wipe her face, or some of the suggestive things. I think that CBT sometimes is being similar to Socratic questioning or
I
dialogue.
think what I'm actually quite interested in is not so much looking for where we disagree with other approaches, but
Hmm.
looking for where we agree or where there's overlap or where there are parallels. One of the British leaders, well, I think she was originally born in the Netherlands and then trained in France, but Emmy van Deurzen, she
Right.
wrote in one of her earlier books that you have to be a little bit careful when people say they're eclectic because
Mm.
not everything goes with everything else.
Right.
She said
Hmm.
if you want to use an existential approach, you can't then say, I'm going to tell you to go away and do some homework. That doesn't fit with respecting the autonomy of the individual.
Right. Right.
So
That's a good point. Because
yeah.
if you look at people's websites, if they're just advertising themselves as a licensed family counselor or whatever, and they list all their methods, I get the impression that they're just stacking that deck to make sure that that pings on every search engine, or that but they don't really do all those things. But
Hmm.
anyway, so let's take a simple issue like depression. As a pastor, if someone says, I'm dealing with depression, uh, my first response to that would be, have you seen a doctor?
Hmm.
Have you had a physical? Is there, because that's not something I can do. That's not something. So, what if it's a thyroid issue or something? I understand that there could be a connection. My second,
Sure. Yes.
have you had a psychological evaluation? And then let's talk about the possible spiritual connections. In fact, I don't mind leaping over one and two. in that moment if they understand that I'm not ruling out that there could be a physical cause
Hmm.
or a psychological cause. And a lot of ministers are just taught refer, refer, refer when somebody wants counseling. But the to me, the opposite side of that problem is somebody may go to see a physician or a psychiatrist who doesn't believe or doesn't think like a logotherapist in terms of there being a noetic dimension. And well, you're depressed. We don't really know why, but here's some antidepressants. It's going to make you feel kind of dull. The frontal lobe is going to slow down a little bit. And then you come back, I'm still depressed. Well, let's up the dose or let's add another, and there's potential harm in that. So it's nice to meet somebody who can do the whole range of whatever. And I also have before you say anything, I have a saying that most of us can't tell the difference between a panic attack and a heart attack. But
Okay.
I think Chris Wurm can.
Okay. And I think I probably would also want to know, have they got reasons to be sad?
Mm,
Um,
mhm.
you know, have they had a falling out with someone they're close to? Have they got financial difficulties? Has something happened that you can understand the sadness? I'm interested in the way people use words, the way people use language, and I think um, physicians don't own the word depression. I think even in meteorology, weather reports, people talk
Oh,
about a depression off the coast of such and such. Um,
hmm.
so I think the first thing, if someone says to me, "I'm depressed," I'll say, tell me more. But I might then want to see whether what they call depressed is the same as what I call depressed. If this sadness is associated with lower energy earlier in the day, difficulty sleeping, increased levels of anxiety, possibly even losing weight when they're not trying to lose weight, those are things that might make me more suspicious of a depressive disorder that might perhaps respond to medication or other types of treatment. But if in fact they have not enough money to pay the rent or buy food or um, do nice things for their children, perhaps there's a genuine reason for sadness.
Hmm.
And this is where I was quite impressed with some research I came across. People had decided to ask the people attending a mental health service what would they particularly value? What would they like the mental health service to do for them? And they didn't say, our number one wish is to have our symptom score reduced. They said, we want help with things like housing, relationships with other people,
Mm,
financial difficulties,
mhm.
and coming to terms with our psychiatric disorder. But yeah, if somebody is mentally unwell, but they say, I'm really worried that I don't have a place to sleep,
Mhm,
um, then maybe it's valid to help with housing,
mhm.
even though they also need treatment for their mental illness. And
Right.
and and there's around the world, I think Finland is doing this particularly well. I think Canada perhaps in some areas, but the idea is if somebody has a substance use problem or a mental health problem and they're homeless,
Hmm.
if you provide housing, um, those other things might become easier to manage.
Right. Oh, that totally makes sense. Yeah, absolutely.
So, so
Absolutely. Yeah, very good point. So now your specialty, addiction.
yeah, yeah.
I'm going to leave it at that. Go ahead.
Yeah, look, I even sometimes wish they'd found a different word for it. I think people
Uh,
sometimes talk about addiction and it already sounds like you're calling people a bad word. You know, if
mhm.
you say somebody is a drug addict, there are probably very few communities where that sounds like a neutral statement.
True.
That
Mhm.
you know,
Yeah.
um, so and some other terms that people have tried to use, they've said, oh, well, perhaps should we call it drug abuse? Should we call it alcohol abuse? And I say, well, hang on. If we talk about child abuse, I think there's a pretty strong understanding that's probably a bad thing, probably a criminal thing. Uh, but if people are using alcohol in a way that perhaps leads to difficulties in their personal life, um, I sometimes say the word abuse suggests that you are using something in a way that's not the way it was intended. But I tend to say, well, what is the way that beer is intended to be used? What is the way
Mhm.
in which vodka is intended to be used?
Mhm.
So if somebody is drinking it, um, then the concept abuse is perhaps a bit of a silly one. Um, Speaking of silly, I then go on to say, if people use beer to wash their hair, that's abuse. You know, a beer shampoo, that's silly. You know, but if somebody is drinking beer, calling it abuse, uh, one of my real concerns is if you try to put information out there into the community so that people who might benefit from the information will see that they need this information. If you say, here's a brochure for people affected by alcohol abuse, a lot of the people who are drinking at a level where they are likely to get harmed do not feel like they're abusing alcohol.
Right.
They
Yeah.
feel like they're drinking, and they'll often say, but I'm not drinking any more than my circle of friends. Sometimes with alcohol dependence, people accumulate more and more friends who do drink in a similar way. People who are using drugs in a place where the law says this is illegal, it's not surprising they might have more and more acquaintances and friendships with other people who are prepared to break the law to get the drug that they like. Um, it was so good of you to introduce me to Jaime Panicia. So I could double check. Was I using a word in this old uh, journal article? Was I using a word that was offensive? And I think he was saying it might not be a word people use so much anymore, but he didn't think it was offensive. But
Yeah.
it was an article about people using heroin and
Mhm.
people saying, and particularly there was one person that said, well, I currently view myself as a drug user. In fact, I think in the article they used the term junkie. And he said, maybe
Right.
one day, maybe one day I won't see myself as a junkie. Maybe one day I'll see myself as a Chicano. Um,
Yeah. Mhm.
Sometimes people, their pattern of investing time and energy and money into finding and using and recovering from a substance begins
Mhm.
to take over from nearly everything else in their life. Um,
Yes.
so one of the terms they use, they talk about salience. And I guess I'm especially interested in where is it that people do have freedom? Where is it that people are perhaps going to have trouble making a different choice? And I think if somebody who decides not to use alcohol today, if if they then get sweaty and shaky and they have nausea, they may even vomit, if those things happen until they have some more alcohol, um, then they're sort of free to choose not to drink, but it's a different kind of freedom than somebody who wakes up and it's very easy to go through the day without alcohol. So
Right.
um, I think sometimes there is a place for helping people manage those withdrawals. So that perhaps includes some medical input, nursing care,
Yeah.
being in a safe place. Um, but sometimes people won't necessarily be sure, why would I change? So that brings us back
Mhm.
to W.R. Miller and motivational interviewing and that Socratic
Yeah.
questioning.
Yeah.
And sometimes there's the other question: if you weren't using alcohol in this way or heroin in this way, um, you would then have time and energy that you would have to decide, how will I use that? What will I do now with
Hmm.
the time that I used to spend finding and using alcohol or heroin or
Right.
um, uh, and for some people that might seem like a difficulty, that might seem like a problem, but of course with an existential approach you might say, but isn't that perhaps an opportunity? Isn't that a good thing that you've now got these possibilities? But Frankl talked about the need to balance freedom with responsibility. So if
Hmm.
you are now free to do things differently, you're also responsible for what you do with that freedom.
Right.
And I think Frankl would have been um, aware that if somebody is not going to be able to do things because their withdrawal symptoms get in the way, then
Hmm.
I think he would have been in favor of managing the withdrawal symptoms so that the person
Hmm.
then becomes free to make different
Yes.
choices.
Yeah, that makes a lot of sense to me because, I imagine that a subject like addiction is fraught because you're not just talking about, well, you could just quit if you wanted to. If you just found the meaning of life or the purpose, it would be
Mhm,
easy for
mhm,
somebody to say that, but there's still the physical, the withdrawals and the all the things you talk about. I'm sorry. I was in a Rotary Club for a number of years with a guy who ran a methadone clinic, and I was very naive before I met him because I didn't realize they're giving basically a controlled substance to help them to deal with the all the other substances they were trying to get free of. So,
mhm, mhm,
I guess methadone in place of uh, crystal meth or in place of heroin or whatever it was. I don't want to say too much because obviously I don't know what I'm talking about. But so clearly I would think that if I may speak as a theologian for just a second,
mhm,
that there is a danger for someone who's just pure logotherapist to commit a Gnostic error in which we prefer the spirit and deny the body, if that
mhm,
makes any
mhm.
sense at all. So clearly, it's more than just uh, the will to meaning when you have a physical dependency on a drug. Is that true or not true? Is logotherapy a first order or a second order treatment?
Ah, for me, it helps frame my questioning right at the first appointment.
Hmm.
Um, but but I suppose I probably use several different things all at the same time, and I
Hmm.
I also then want to know, well, um, you know, let's get some blood tests done. Let's check your blood pressure. Is there evidence that this pattern of alcohol use is affecting your physical health? I'm actually quite interested in the role of alcohol in early onset dementia. So sometimes people say, I recognize that my alcohol use is a problem. I must stop. And sometimes people say they're going to stay off alcohol, and if they come back to hospital a couple of months later, sometimes the nurses and the doctors can be very disappointed if the person previously said, I won't use alcohol, and then it turns out they're drinking again. I then want to double check, do they actually have good enough psychological function? Can they actually remember everything they said? Is their frontal lobe working well enough that they can actually implement a very different daily routine? So it can be that some people will say something because they don't want to disappoint others. But sometimes people will say something because they absolutely mean it, but their nervous system impairment makes it
Hmm.
hard to put into place these changes.
Mm.
So sometimes I'll even want to have some brain imaging done and see if there's evidence of brain atrophy.
I see.
And certainly one of the other things that happens with alcohol use sometimes while people are increasing their alcohol intake, that takes away their appetite for food, and sometimes they don't get around to eating such a healthy diet. And some people have some vitamin deficiencies that
Mm.
really accelerate some of the brain changes. So there's a condition called Wernicke's encephalopathy, and that ultimately can lead to Korsakoff dementia. So it's a form of brain damage where people sometimes answer a question with what seems to them to be a reasonable answer. They're not deliberately lying. They're not deliberately trying to trick people, but their brain fills gaps with answers, and yeah, people call that confabulation. And so I think rather there were some very old concepts. People often talked about denial, um,
Yes.
and I think once again with some of those perhaps more judgmental approaches, if people would say, do you drink? Instead of saying how many days a week do you use alcohol, if you convey with your tone of voice that if they say yes, I drink, that you will think they're a bad person, can
Right.
can
Just
we
like a child.
somehow,
Somehow, a lot of times a
um,
child will answer what they think you want them to say.
yes, yes,
Yeah.
yeah. Um,
Mhm.
and so certainly people often talked about denial, and I think once again, talking about motivational interviewing, is denial actually a reflection of the sense that the client picks up that certain answers will not be welcome, that certain answers are more desirable than other answers. So I think there's a skill in having people feel like it is safe and helpful to open up.
Hmm.
Um, and That, yeah, that's
Well,
easier in some settings than others.
sure. Well, I think this is kind of the genius insight that you have brought forward, and have a couple of articles here that you wrote, that you graciously sent me, and one of them is definition, diagnosis, and treatment of alcohol-related problems. And a lot of what we've been talking about, you have mentioned a lot of the things that are in here, but just to kind of put it in a nutshell, what just really grabbed me as a wonderful insight that you have brought forward here is that you can say we have a problem with alcoholism, so let's write some literature and make it available for people who are alcoholics. And the problem is if a person who may say, well, I'm not an alcoholic, their liver may
Yep,
be
yep.
destroyed, but they may have cirrhosis and they may be, on their last leg, but I don't have a problem. So how we frame the question, how we frame the problem, or the issue. I don't even know if problem is the right word. It seems like a problem. But to me, that's one of the great insights that you brought. And I have another thing to say about that, but I'll stop here because I think you're ready to talk about that.
Okay. I love the word problem. I think you can often say to somebody, look, if a person goes a whole year without drinking, but on this one day they drink enough that they then stumble and stagger and hit their head on a lamppost, that's a problem. It
Mhm.
might not be the kind of problem people expect an alcohol-related problem to be. If
Mm.
somebody once again becomes intoxicated and they have a job and there's a staff Christmas party and they say something that makes their manager upset and they lose their job, that's a problem. It might not be alcohol dependence. So I suppose I'm really interested in there might be people who are using alcohol, just a certain volume of alcohol, a certain amount of um, standard drinks, and it might be that they still do have control, that they are able to stop or start, but
Yeah.
that weekly intake of alcohol might still mean their blood pressure is high, the risk of a heart attack or stroke is increased. So that's a problem, but it might not be that they are alcohol dependent. And I think the word alcoholic and the term alcohol abuse, I think there was perhaps a time that people knew what that meant, but now it seems like it might mean all sorts of different things to different people.
Yeah.
I think Alcoholics Anonymous, the AA organization, they have every right to use terms they find helpful. But outside of AA, I'm not sure that that many people find the word alcoholic so helpful. And I would also say that AA still offer a form of support that people will very rarely get from a physician. If somebody participates in Alcoholics Anonymous, they will sometimes be offered a mentor or a sponsor, and that person will sometimes say, "Here's my personal phone number. Ring me
Mhm.
anytime."
Right,
So
right.
I think that and certainly within AA, there are these 12 steps, there are these traditions. In fact, I think some of it has quite a lot of overlap with that search for meaning and purpose. I think some of
Mhm.
it does acknowledge a spiritual dimension.
For sure.
And then one of the things that some people worry about with AA, it talks about we admitted we were powerless over alcohol, and then there's reference to a higher power.
Hmm.
And some people, they assume that means a particular kind of religious framework, and other people find an AA meeting where they may say the higher power is more like the life force or more like just how wonderful it is to be alive. So sometimes people might benefit from AA and they may need to find the right meeting where the words mean something that they're comfortable with.
Right.
Um, so yeah.
Yeah, I mean, to me, this sounds like a criticism. It is not a criticism. When I say that AA is kind of like a pseudo religion because it has many of the characteristics of a religion. And again, it sounds critical, but it's not meant to be critical. Um, but, when I translate your insight to my own field, of course, I'm a pastor of a church, you know, what to rephrase what you said, to call people alcoholics or to use the term alcoholic may be unhelpful because people don't relate to it. And it kind
Mhm.
of makes me think about how, 100 years ago, 80 years ago, the church had this message: you're all sinners, we're all sinners, we're all going to hell, blah, 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 blah. And today that message doesn't resonate. And most preachers don't believe that either. I mean, maybe
Mhm. Mhm.
not in the way it was expressed 100 years ago, you know. And in fact, the way it was expressed 100 years ago, 200 years ago, may not have been the way it was expressed 2,000 years ago. But the unhelpful use of vocabulary. And so I sometimes see AA in that old kind of mentality as well. Just like the temperance movement came out of uh, all around the same time period. It had a religious fervor to it, and it had this sort of clamping down and shaming and guilt riding people uh, as a way of trying to stop what they perceive as a problem. And of course,
Mhm.
it's a problem.
Mhm.
I also have to say that I earned a master's degree in Jewish studies. And the reason I mention that here is because I was in a class on Jewish liturgy. And it was at night at a rabbi's house. And he talked about how, particularly in Orthodox communities, men get together and they drink to a certain degree. They dance and they sing. And I
Hmm.
in
Hmm.
my evil twisted mind, I'm thinking, so they look like the Amish, but they do the exact opposite of the Amish because the Amish, don't drink, don't dance, whatever. But he says the thing that you don't understand is Americans drink for the wrong reason. They drink to
Hmm.
get drunk. These men drink to get happy. They sing to be happy. They dance to be happy because happiness drives away evil spirits. You
Right.
know. So it gives a different meaning and a different approach to drinking. And it also means that they don't drink to excess on a daily basis. They might drink to excess at a special time and they're in a special place and they're not going to drive, a car because it's Sabbath or whatnot. So um, interesting how you frame the issue can have a lot to do with the treatment, I guess, or the perception.
Yeah, and certainly within different societies, different cultures, different religious organizations, there will be some organizations or some religions where alcohol is part of a religious ceremony, but also there'll be times that alcohol is viewed as risky. I'm one of the few Australians who has never been to Bali, but apparently in traditional Balinese belief, if you do something on the wrong side of the mountain, that is a bad thing. And if you're affected by alcohol, you could easily lose track of which side, what is your orientation towards the mountain. So certainly there are other ways of viewing the role of alcohol. Is it partly to bring people together? There are some cultures where it's to do with conviviality, that's to do with socializing.
Yeah.
There's a trade-off between the usefulness of alcohol venues, pubs and clubs, as a place where people see each other and develop support. Um, but there are some people where the only place that they socialize is a club or a bar.
Mhm.
So, but if I think if you take a view that all alcohol use is evil and harmful, then you might end up with some very isolated, bored, frustrated people who are missing out on some of the advantages of human interaction.
Yeah. Plus, you
Um,
can't use mouthwash
Ah, well,
or
I
cough
have one or
medicine.
two patients. I have one or two patients. I have to say they have to use a different mouthwash.
Mhm.
Um, yes, yes,
Yeah.
yeah, sure.
So, I mentioned then, kind of, I think we're in a good place to start wrapping up. One of the things you mentioned here in one of these articles is the shortcomings of the dominant biopsychosocial model.
Ah, yes,
So maybe that's a good place to kind of bring everything to a conclusion, finish with logotherapy, and dazzle
yeah.
our audience.
I think some of that actually relates to journal articles by a doctor called Dr. Leslie Drew, and he was on a committee with me at one stage. He was very experienced, and I was really quite junior, but he was a lovely, genuine person. And I think his religious background was Salvation Army. But
Mm.
he'd also been interested in the work of a Californian philosopher called Herbert Fingeret. And um, although there's this sort of sense that a long time ago, people viewed alcohol problems as a moral failing. There was later on a suggestion that perhaps if we viewed alcohol problems as being a disease, people might be less critical of somebody with a disease than they would if they saw it as a moral failing. But Fingeret and then Les Drew and other people have suggested, but if we call it a disease, how many other diseases are there where a person goes to a bottle shop, points to a product, pays for it, takes it home, and then uses it? How helpful is it to say that's a disease? On the other hand, it may be quite appropriate to say that it can lead to liver disease. It can
Right.
lead to Korsakoff psychosis. It can lead to early onset dementia.
Mm.
Um, but Fingeret used the term, he talked about it rather than being a disease or a moral failing. He said, what if we just say that it's a way of life? And Leslie Drew, Dr. Drew said, what if we call it a way of life leading to predicaments?
Okay, right. Yeah.
If we still say, yes, there is an element of choice that people need to decide, I will go to the hotel or the bottle shop, I will choose this particular product, I will pay for it, I will take it home and I will drink it, or perhaps I won't even take it home, perhaps I'll drink it sitting in a park. And then you have questions about um, if a community makes a law that you're not allowed to drink in public, which individuals are most disadvantaged by that? And that then comes back to more Aboriginal people are arrested for public drunkenness, but if there's a pattern of sharing things and perhaps not necessarily liking the kind of buildings that are around. Anyway, so this idea of perhaps if we say it's a way of life, but it's a way of life that leads to predicaments, um, that might be a contrasting view. And sometimes I will still say, as a physician, I can write a document that says this person is affected by a medical condition and they should have time off work, or they may even be entitled to social security benefits. So
Mm.
sometimes I will act as if it is a medical condition, and sometimes I'll say it might be more helpful to talk about it being a way of life, and to then talk about the advantages of continuing with this way of life or the advantages of choosing a
Mm.
different way of life.
Right.
Um, and what might life look like if you do things differently?
Yeah.
And perhaps that's when it might be appropriate to say, and in terms of how you might decide what are virtuous ways of living, in terms of deciding what would be preferable, perhaps that's where the transfer from medical to clerical, maybe that's where you might say, these are probably not questions that doctors are good at answering, and maybe they're not questions that pastors expect to answer, but maybe pastors are better having the conversations. And I think that was, I think, part of Frankl's message in the book, The Doctor and the Soul.
Hmm.
He even said at one stage he wasn't 100% happy with that translation of the
Right.
title.
Yeah.
It
Yeah.
was it was ärztliche Seelsorge, and
Yeah.
Seelsorge is sort of spiritual counseling, and
Seelsorge
spiritual
means
counseling.
pastoral care. It literally means pastoral care. If you ask any
Yeah,
German, pastoral care, Seelsorge is what it is.
and so I think Frankl identified that increasingly, even back when he was young and active, people would sometimes perhaps not go to a pastor or a rabbi or an imam.
Right. Yeah.
They would go to the doctor, and some doctors could deal with it, and some doctors would say, if you have a symptom, let me offer a treatment. But
Mm.
yeah, the idea that sometimes people are asking questions. Um, I'm really glad that I had a chance alongside my university course, alongside my training, to also learn about Frankl's approach and to learn about
Yes.
logotherapy so that I would have something so that if people ask me philosophical questions, I can say there are ways of responding to this that don't involve me saying this is a mental disorder.
Yes.
Mhm.
Yeah. Well, it's been very nice having this conversation. I especially appreciate these articles that you sent me, and I encourage anyone watching this podcast, whatever you would call this thing, uh, to look you up and to see if they can read some, particularly this one titled Definition, Diagnosis, and Treatment of Alcohol-Related Problems, because I think you do uh, bring logotherapy in, but also because even Frankel, he wasn't strictly logotherapist in terms of the fact that he was a neurologist, a psychiatrist, and he did pharmacology, he did surgeries, he did all those things. And so there's a whole broad range of things, and we all kind of fit in there in one way, shape, or another. But I do think that the overall concept is that even if someone is addicted, even if someone has a problem with alcohol or whatever we may um, frame it, that behind all that there is a human spirit, there is a human being with all the gifts and qualities of a spiritual being. So I think that's um, a great takeaway from this conversation as well. I do believe that. Oh, go ahead. Sorry.
No, I was just going to thank you for your time and your interest.
Yeah,
And yeah,
absolutely.
if this helps somebody out there, that would be wonderful.
Absolutely. And I envisioned, so my website, it's behind my head here. You can see meaningandministry.com was originally what I called it because I wanted to bring the concept of meaning from logotherapy. And then I got to thinking, well, what I'm really doing is trying to help pastors in terms of providing pastoral care, Seelsorge to their people, you know. Um, so I renamed it pastorallogotherapy.com. So we have both URLs. I was at a men's retreat last weekend and spoke to a group of men, and some were pastors, and and this came up, and the guy said, "Well, we've always just been told refer, refer, refer." And the reason for that is because so much damage is done by pastors who have good intentions but no training in counseling, or no uh, maybe they have training in what's in, that's not good, healthy approaches to counseling. So I tried to explain to him that there is room for us from a noetic point of view via logotherapy to bring in the spiritual elements of it. But yes, if someone's having a physical problem, if they're having a psychosis, I don't treat schizophrenia. I don't deal with people who are bipolar, not as a first order treatment. But I love what Frankl wrote in The Will to Meaning. Maybe Joan of Arc was a schizophrenic to a psychiatrist, but it doesn't change the fact that she was also a saint.
Mhm, mhm.
You know, so and behind any psychosis, whether it's self-induced or congenital or whatever, there is a spiritual being, and I see it time and again. People on their deathbed, people in severe crisis, in spite of the physical, in spite of the psychological, there is a, a spiritual being behind it all that can be reached, and if they can be reached, they can endure a lot of things. So uh, I guess I'm just rambling now, but hopefully it's
You've reminded
informative.
me that I think one of the real benefits to me of having that exposure to Frankl and his ideas and then the training I did in logotherapy and existential analysis, I would sometimes take an interest in people um, because I wanted to explore their questions about meaning and purpose. And sometimes some of the people I see, not everyone shows an interest in.
Yeah.
And I then sort of would be curious, well, how would this fit with logotherapy? And sometimes, yeah, that discussion would be, if people are talking about a sense of meaninglessness or emptiness in their life, I would think, oh, that's interesting. And yeah, I think that just somehow meant I began to see people who perhaps had conditions that had often been considered to be hopeless
Yeah.
and difficult and sometimes um, I would find that there's a whole literature about people that do well without treatment. And I think that the real magic, and I don't think anyone can really tell you how to do this, but if there are some people that are going to improve without any intervention, is there anything we can do to make that even more likely to happen? How do we not derail those people who are actually going to bounce back? Those people for whom this was a temporary thing, and I think my addiction specialist colleagues would still acknowledge that for generations, there have been people with drinking problems who did stop drinking. There have been people, even in the days of the Vietnam War, people going from US and Canada and Australia to fight in Vietnam would sometimes develop a heroin habit while they were there. But
Hmm.
when they were no longer in Vietnam, partly perhaps because it was harder to get, but there's this whole literature about people that
Hmm.
had a problem with their drug use or their alcohol use, and then it wasn't there. And
Right.
some people need a whole lot of extra help, but yeah, it's useful to be aware of those situations where things actually improve, and maybe they improve and then they get worse again. But yeah,
If you could just bottle that,
anyway,
right?
so. Well, look, thank you again for your interest, and
You
yeah,
bet.
I've appreciated a chance to get to know you and good on you. Thank you very much.
I appreciate